and welcome back to our next video. So a lot of veterans ask us every day, how do we get the knees service connected? And more importantly, how do I prove for my military service that my knees are because of my military service? And so the first step, of course, is making sure in your medical records that there is a diagnosis of some type of knee condition. And so today I have Dr. Lynn with me. She's our chief doctor here. She's going to go over a lot of the framework that she put into a lot of DBQs that she do for veterans across the world about the particular knee condition. So, Dr. Wynn, you've seen a lot of knees and a lot of knee conditions with veterans. Give us your spiel.
Yeah, so the general condition of knee pain, which is what we often encounter when the veterans come to us, can be either connected to your service directly or secondary to service, related to an injury that you had in the service, not related to your knees in general, but then knee issues develop as a result of compensating for that. So some primary conditions where the issue starts directly in the knee is you can have osteomyelitis, like infection of the knee joint, tuberculosis of the knee, rheumatoid arthritis, where it's degeneration of the actual knees, the degenerative arthritis, rheumatoid arthritis, gout, bursitis, knee instability in general. Maybe you had an injury in the past that's left you with instability. And in general, limited range of motion from chronic physical activity using your knees. Secondary conditions include knee pain that's as a result of another condition. Like if you had a back injury and now you have to compensate because you're walking abnormally with poor posture, or something that's unusual that you're compensating, and then you're causing pain to the knees that way. You could have an injury to one knee, have it partially or totally replaced, and then the other knee is compensating, resulting in pain in that other knee that was once normal, is now having issues, so that knee would be secondary to that first knee. You could have hip injuries, foot injuries. So pretty much just strain on body parts that results in the knee having issues now. The key is that the examiner also has to use a goniometer to do your range of motion, like in the back DBQ as well.
Awesome. So with the knee, of course, comes a lot of different moving parts, and I'm going to revert to my screen here to make sure that I communicate very clearly to each of you out there, whether you are a client or whether you are someone just watching our video, of how the knee is rated. And so the knee is rated in three different ways. As Dr. Wynn has expressed, you have instability, which is a big one. You also have flexion as well as extension. And so if you cannot properly, range of motion wise, move your knee up and down, that's one condition. Move it backwards is another way. And of course, you find yourself unstable. And so what is instability? Instability could be you using a cane to support yourself, or maybe there's times in your environmental surroundings where it's hazardous and your knee gives out and of course you fall, which leads to a lot of other things as well that we're seeing in the firm. And so from a rating standpoint, ankylosis of the knee under diagnostic code 5256 rates at 60% if the flexion is at an angle of 45 degrees or more. Flexion in between 20% and 45%, with ankylosis is a 50% rating, and it goes down from there. When there's ankylosis of the knee, you're looking at a 60, 50, 40, 30, 20, or 10% rating. If there's patellar instability, like we expressed before, your knee can be unstable. If that's the case, you start off at 10%, you can go from 10, 20, and 30 based on a diagnosed condition involving the patellofemoral complex with recurrent instability. That's 30%. Now, of course, range of motion is the name of the game, much like the back as well. So the least amount of flexion and extension and, of course, instability you have in your knee, obviously the higher your percentage will go. And so as we continue to look at this particular document, 45 degrees rates at 50%, 30 degrees rates at 40%, 20 degrees is at 30%, and 15 degrees at 10%. And of course, at 10 degrees is 10. If you have zero or limited extension of 5 degrees, you get 0%. This can be a little bit complex. The knee can be rated in multiple ways. Of course, for every single veteran, it varies and it differentiates amongst veterans, excuse my language. But more importantly, the biggest part is making sure you have evidence to prove this. That helps us out, helps Dr. Wynn out as well, so we can be able to put together a solid case in your favor. So the needs, once again, range of motion, event and service, a diagnosis, evidence thereof. From that point on, we can take care of the case for you and make sure you get your percentage. So thank you once again for joining us. That has been a knee coaching session, overview of the knee, and I hope that we can get your percentage if you're our client for the knee. Thank you.